You know, when the COVID-19 pandemic hit, the world had to make an impossible choice. How do we protect our most vulnerable loved ones, our parents, our grandparents, from a brand new virus? Well, we had to isolate them. It really felt like the only option. But what if that very act of protection created a whole new, hidden crisis?
So here's how we're going to break it all down. We'll start with what we're calling the pandemic's protection paradox. Then we'll look at the very real impact on both mental and physical health. After that, we'll dive into a toolkit for well-being and finally talk about the path forward.
All right, let's dive right in with Section 1, a pandemic's protection paradox. Or, how a solution that was meant to save lives ended up creating a whole new set of problems.
I want you to think back to early 2020. This new virus is just exploding across the globe. And for every health official, every government, the single most urgent question was this one. How on earth do you protect the most vulnerable people in our society?
And pretty much the entire world landed on the same answer: quarantine and social distancing. I mean, it made sense, right? It was the most logical, immediate shield we had against a threat we were still trying to understand.
And look, there was a really good reason for this drastic step. This wasn't just a guess. The data showed that over 95% of COVID-19 fatalities in Europe were among people over 60. That's just a staggering number that really drove home why these measures felt so necessary.
But here's the twist. This essential shield, this act of protection, came with a hidden and frankly devastating cost: profound social isolation. It meant cutting our elders off from family, from their friends, from their communities, from all the things that are so vital to their health.
And that isolation, well, it started to take a real toll, which brings us right to our next section, the impact on mental health. These are the invisible wounds of the pandemic.
And when you look at the numbers, you really see just how big this problem was. Researchers looked at studies from all over, Asia, Europe, America, and what they found was this massive range. For anxiety, you're seeing anywhere from 8% all the way up to almost 50% of people reporting it. And for depression, it's from about 15% to over 47%. The psychological hit was just huge and incredibly widespread.
And it wasn't just anxiety and depression. On top of that, the studies found people were sleeping worse, dealing with way more psychological stress, and feeling this deep, pervasive loneliness. And what's really interesting is that the research pointed to a higher risk for women and for folks who already had a negative view of aging.
But the impact wasn't just in their heads, right? The toll was physical too. And that brings us to Section 3, the toll on physical health, and this kind of unseen decline in just moving around.
The change in day-to-day life was just night and day. Before all this, lots of older adults were going to group exercise classes, taking regular walks. But during confinement, attendance at those classes just plummeted, and the time people spent doing anything vigorous or even just walking dropped off a cliff.
So why does this matter so much? Well, for older adults, a drop in physical activity isn't just about missing a workout. It is directly linked to an increased risk of frailty, more falls, and making chronic diseases even worse. It's a real threat to their independence and their overall health.
Okay, so we've laid out the problem, and it's a serious one, but the good news is the research didn't just stop there. It also gave us Section 4, a toolkit for well-being, packed with evidence-based strategies to help people reconnect and build resilience.
A huge part of the solution was something called telehealth. And all that really means is using technology, things like video calls, special apps, even just telephone hotlines, to deliver healthcare and information from a distance. It was a way to bridge that physical gap.
So what did the experts actually recommend for mental well-being? Well, first and foremost, strengthening those social connections with things like video calls and phone calls. Another huge one was just maintaining a daily routine, for sleep and meals. Other powerful ideas? Stimulating the mind with exercises, limiting the news to cut down on stress, and even framing quarantine as an act of altruism, a way you're helping other people.
Now, what about getting moving again? Well, organizations like the World Health Organization have some pretty clear guidelines. The goal for older adults is about 150 to 300 minutes of moderate aerobic activity every week, plus at least 2 sessions of muscle strengthening and 2 sessions focused on balance and coordination, which is so important for preventing falls.
And look, this doesn't have to be some crazy, intense fitness plan. It's really about small, simple steps you can actually do. Just get up and break up long periods of sitting every 30 minutes or so. Do some at-home exercises like dancing or even squats in a chair. Follow along with online videos. Walk around indoors, or if it's safe, get outside.
These small, consistent efforts can make a massive difference.
All right, so after all of this, what's the big takeaway? Where do we go from here? That brings us to our final section, the path forward, and how we can use these lessons to reconnect for a much healthier future.
The researchers themselves really put it best. They came to a very clear conclusion, saying a multi-component program with exercise and psychological strategies are highly recommended. It's not about choosing one or the other, it's about how they work together.
So, if there is one thing, just one single thing to take away from this whole global experience, it's this. Protecting someone's physical health can never, ever come at the cost of their mental and social well-being. They are completely, fundamentally linked.
And that leaves us with a really important question, one that goes way beyond just this pandemic. Moving forward, how can we design our communities? How can we use technology to make sure our elders are always connected, always supported, and always engaged? Not just during a crisis, but every single day.